big society funded CIC. We've been going for a couple of years. James and I are essentially consultants. We work with the charitable sector, voluntary sector across East of England and London. And actually we got the idea of setting up the CIC, which brings us together on some work assignments from the Minister, Nick Hurd, when we did an event some time ago around the issue of big society and what that meant. And our CIC, we're trying to help those organisations that are at the coalface, that are working with disadvantaged and marginalised communities, trying to work with them to help them do their work better. And actually in the environment that I think we all are now in, we're trying to help them survive the austerity that a lot of the sector are going through. We've been associated with this career, I think, now for a good couple of years, a bit on a paid and unpaid basis. Did some evaluation work around the discrimination service, which looked at the great work that's being done there. And we helped co-produce a lottery bid that was successful and that has taken that service forward. So we're really proud of working with this group, doing that work with you. We really are. We're passionate about the voluntary community sector and civil society. I think it's absolutely vital that people are there, engaged, being these fiery spirits. We think that is so essential. And what we're also concerned about, and in terms of where we're coming from in running a successful voluntary organisation, is how everybody is part of that process. Because we do have, in our view, a hollowing out of civil society, public life, and I think that's now affecting the charitable sector. And we got some money earlier this year. We actually got a small grant from the Awards for All lottery programme with a few £1,000s to begin to do some work within areas where there are a higher number or proportion of people from different communities. We did some work in Peterborough at the moment, some colleagues who are in the audience from Peterborough, Kings Lynn, an area that changed and flux, and obviously here in Ipswich as well, where we partnered up with ISCRI. So we've looked at what's going on in these three localities, Kings Lynn, Peterborough and Ipswich. We're going to say a little bit more about what we found out in the context of Ipswich and the survey and the report, which is in your pack that you kindly can see up. There is a copy of our report in there. I'm sure not everybody's had a chance to read that yet.
Do you mind if I just grab that and show people what we're talking about? So that's the report, folks, which is in your pack. There we go. Okay, so I'm going to just take over for a while just to talk to you about the findings from our research so far. So the research we did, it was the best we could do with the kind of budget at the time we had. And it had two elements. It had a desk research element, which was the first phase, where we produced a sample of charities, key charities really, in each of the three areas of Kings Lynn, Peterborough and Ipswich. We looked at the kinds of organisations that are quite mainstream in the audiences they're trying to reach, and did what we could to find out about their boards really in terms of gender and ethnicity. It was pretty impossible from a desk research point of view to look at the other areas that we're concerned with in the report, age and disability. But from looking at websites, finding information in reports, looking at the Charity Commission website, accounts, all these kinds of documents, we were able to ascertain, and we've been really honest in the report. We're not saying it's perfect, but the best we could do. And that told us about 45 charities, key charities, and how they were faring in terms of board diversity. We looked at some key public bodies in those three areas as well, and again used similar sort of sources from a desk research point of view to get some sense of how diverse their boards were. And then we also did a survey, our own survey, which asked questions about diversity of boards. It covered off age and disability as well, and it also asked people about their staff team diversity levels and their service user diversity levels. We were able, with our fantastic partners, ISCRI, Parker, Peterborough CBS and West Norfolk Community Voluntary Action, to reach out to about over 600 organisations. They all supported us to get our survey out to a really good sample of organisations that work in those areas, in those cities and towns, and in the hinterlands. And unfortunately, we only got 34 responses, which you could say with a survey, 5% response rate's okay, but a lot of people didn't fill in the bits about diversity of boards as well. They kind of stopped at that point, which was kind of a bit worrying. So we got all of those results together and we looked at them and we compared them with kind of ONS stats for diversity levels around ethnicity, disability, gender and age in each of those localities. And we have to say the results weren't very good in terms of saying they told us that diversity levels of boards and even staff teams were not representative. And then when you looked at the service user levels that organisations had, and diversity of service users, and then compared it to their boards, it was about 2. There's a good thing, which is the last point, which is that there was some interest in improving this, and organisations were, when asked, plenty of organisations when asked said, yeah, we would like to do something about it with some support if further work is done, and we would be an organisation that would look to improve our diversity levels if you could support us. In terms of the detail then of the findings across all those 3 areas, there were 34 charities in the survey, average of 11 trustees per charity. Just 8 trustees in the 34 charities were aged 18 to 24. That was 4% of the trustees were in the young group, whereas they compared to in the local population, they measured about 9%. Just 14 trustees identified themselves as having disability. That's 8% of the sample, but 23% of the charity's service users identified themselves as having disability. So again, or a definition, so not very reflective again. 36% of trustees were female, but not the 52% in the population. And this was the biggie of those charities that are not focused on supporting BME or BAME communities. And there were some who did respond. It wasn't what we were trying to do. It wasn't mainstream organisations we were focused on. Some responded. We had to take those results out because it didn't reflect, it didn't help our analysis, because BAME organisations tended to have high proportion and high representation of service users. There were none in the mainstream organisations. So most of the charities that we heard from were mainstream public organisations that were the whole population. And there wasn't a single trustee from a BAME community. Ipswich, which is big focus for today, the key findings for that were that despite, and this is from both the survey and the desk research, despite the population of Ipswich, the BAME population of Ipswich being 11%, only 4%, 6 out of 142 charity trustees were from a BAME background. Sorry, this is from the desk research. Only 34% were women. None of the New Anglia or Greater Cambridge and Greater Peterborough led boards, which are the 2 boards that work in the 3 areas that we've been focused on, were from a BAME background, and only 15% were women in the 2 areas. And the least gender diverse body, and also there was the Norfolk and Suffolk NHS Foundation Trust. All 8 board members were men, and none from a BAME background.
So we do recommend, obviously, that you look through the report. There's details there about the public bodies that we just touched on. That wasn't our main focus, the public bodies, but they obviously impact on the lives of communities, all communities here in Ipswich and across our region. And I think some of the information that we found out there was pretty shocking, I think we would be fair to say. I mean, equally, because obviously we work in the voluntary community sector as a CIC, we were disappointed really with our sector. Because you can talk about public bodies being local authorities and that, some of that is up to the electorate to decide who's their representatives. But in terms of the voluntary community sector, we were disappointed, I think, that there wasn't more of a diversity across those boards that we thought that there should be. We certainly found out in terms of the report that a lot of kind of key charities, household name charities here in Suffolk have really very little diversity at all. We felt that was important to say. And just one other thing that is important to say in terms of the survey, we did obviously work with, in Suffolk, as we work keenly with ISCRI, contacting charities, colleagues individually to a named chief executive to try and elicit those responses. And a number of people just didn't respond, and that was a shame. I think going forward we'd like to try and build on that to ensure that they do get more involved in what we're saying, some key organisations here in Suffolk. So, we were thinking about this a lot really, as two people working in the sector. Who cares? Who cares with these results? Who does care? I think that's something to be discussed today, really. We've just flagged up a few reasons why we think what we found out really does matter, because we think if you involve all communities from the sector and in diversity within the sector and partnerships, you get better services. And all the organisations we've looked at do have public money. They have public resources, be it charities or public organisations. And we think to get more appropriate and effective services, you need to have diverse organisations. We think that's key. We've actually put here, that was me sort of last night, saying who cares? Well, this is about social justice. This is about absolutely everybody having an opportunity to make a contribution. And that's what we mean by inclusive communities. And we think if the government is serious about the big society as an initiative, obviously it was something that was talked about some time ago, but it's talked about less by government now, they need to be inclusive. We also think it's important because of funding. A lot of funders want to ensure that the work that's happening by the voluntary community sector is inclusive and involves all sections of the community. And clearly, it matters for people from diverse communities that their interests are absolutely taken on board and that they're part of decision making, that they're part of service delivery, so that they get the positive outcomes and benefits from the money that is spent. We're going to try and through the course of today, and we just wanted to flag this up with you now, and we've got some forms that we want to hand out at sort of this point. We're calling this social action research. Ways to involve diverse community members, and we want to come back to this at the end of today in plenary. What do we do? It's got to be around evaluation, it's got to be about staffing levels, it's got to be around boards, it's about how you have advisory groups that ensure that everybody's views are taken on board and consult. And we want to explore your experiences of that and for you to let us know on that. And we want to also get a greater sense from you around the barriers to involvement in diverse communities, in voluntary community sectors in particular. And we've got some issues that we all want to come back to at the end of today around what actions we can take, how we can overcome those things. And then from this afternoon, what are the next steps and who wants to get involved in going forward with trying to create more inclusive big society community here in Ipswich and in Suffolk. Thank you.